So we are going to start the session shortly. So those who are watching on the Zoom or on the YouTube, so wherever you are, so just think about your problems in writing because we are going to discuss many things today. So this is the letter. You can go through the letter. This is an official sample. Yes. You can invite your friends if you want. Lahari, Silpa. You can invite your friends if you want. Yes, good evening, Lahari. Smita Kant, welcome. Target 400 plus. Target 400 plus. That is our primary agenda. Welcome, Huma. Divya, welcome. Yeah, so that is the letter. Okay, now let us see here. Just trying to get it into edit format. Yeah, so we have got the letter. So now you have some information here. Learn these things. So the name of the patient, the name of the patient is Miss Betty Wood. This is very important. So first of all, you should know about yourself. You are a community nurse. You are a community nurse, and Miss Patricia Wood is one of your patients. Today, she brought her mother, Miss Betty Wood, the name of the mother. So, mother was brought by the daughter because Patricia Wood is the regular visitor. She is one of your patients. She brought her mother. Okay. She is 59 years old and her date of birth is 5/1/1959. Okay. Right. So, the problem, this is the medical history. So, family history, social history, medical history, family history, social history, complaint, presenting complaint. This is her complaint. It may be true or false. Okay. This may be true or false. Right. Now here, the problem is, concern is here. Unidentified lesion in the right breast. So right breast lesion. So this is the concern. Okay. This is the concern. Right. Now, you're writing the letter. This is a referral letter. A referral letter. Okay. This is a referral letter. So, new students need not worry. There are two Smithas. I think one is Smita Kant. Then who is the second one? Is that your phone only, Smita? Both yours? Okay. So remember this. So target 400. All the new students, no need to worry. You're going to learn everything here. So Divya, Lahari, yes, and Jyoti. So those who are new, so go through these things very carefully because we are going to learn one letter only properly so that every letter can be adapted based on these conditions. Okay. So this is a referral letter and you're writing a letter to Dr. Mary Brown. So Dr. Mary Brown, the name will be here and it is also here. Where is the full name? Take that one because here is the full address. So the address is Dr. Mary Brown. You know the name of the doctor. So when you know the name of the doctor, in the ending you will write yours sincerely. If you don't know the name of the doctor, Dr. Mary Brown, and you only know that she is a doctor, then you will write yours faithfully. So yours faithfully. Make notes, Lahari, make notes, Divya. Where is this girl Sheetal? Okay. All of you make notes, proper notes. Okay. So when you have the name, you will write yours sincerely. If you don't have the name, you will write yours faithfully. So if you are writing to a particular doctor, so name, yes, name, there is name. Then you will say yours sincerely. If no name, then you'll write yours faithfully. So remember these two things. If the name is there, yes. So the name is there here, Dr. Mary Brown. Name is already there. So you will write in this letter, you will write yours sincerely. Remember that. You'll write yours sincerely. Yeah. And then if there is no name, then you'll write yours faithfully. Right. Then next you have the address here. Nixville Medical Center. Then 15 Green Street, Nixville. So there are 4 lines in the address. There are 4 lines in the address. So you are going to write these 4 lines. Welcome Farid. And then there is iPhone Kavipriya. Welcome Farid. Is this Dr. Farid Al Sani? Dr. Farid from Afghanistan. Is that so? Please let me know. Welcome. So Damayanti, welcome. So now we have here 4 lines. So you'll be writing the address. Okay, fine. So what is important? So first thing is you will write the what is the sequence here? What is the sequence here? So you'll write the components, the 7 components of an OET letter. Here they are. The 7 components of an OET letter. So these are the 7 components. So these are the 7 components of an OET letter. Okay, right. These are the 7 components of an OET letter. So first component is the address. So this is the address. So you are going to write the address. Now you have to write these 4 lines, one below the other. So address, we are going to take care of the address now. You are going to, where you will get what type of information. That's very important. So first one is Dr. Mary Brown. No need comma, just leave it. Then Nixville, Nixvill, Nixville Medical Center. Okay, right as it is without any spelling mistake. Next, 15 Green Street. Next one is Nixville. So this is the address. This is the address. So you are supposed to write the address like this. You're supposed to write the address like this. Remember this. So this is component number 1, the address. Number 1, the address. So you are writing the address. Yeah. So yeah. Yes. So this is the address. Sorry. So this will go into your letter. Okay. This will go into your letter. Sorry. This will go into your letter. Green. That will go into your letter. Yes. So you have to write down your address now. So address the letter to Dr. Mary Brown, Nixville Medical Center, 15 Greenwood Street, and Nixville. Write down in your notebook. Write down in your notebook. So yeah. So four lines. Now once it is finished, next we'll go to the, so this is done. This is done. Address is done. Address is done now. Yeah. Address is done. Yeah. So once you are done with the address, then you will go to the date. Now you will go to the date. Okay. The date. Okay. Yes. So next. Yeah. Second one is the date. So where will you get the date from? Date you will get here. So which date you will write here? So this is the treatment record, 6th October 2018. And when is the date? Yeah. So only one date is given. Only one date is given. So that is on his date of birth and then treatment record, 6th October 2018. 6th October 2018. Okay, so that is the only date which is given. So you will write that date only because she has come on that date and it is a visit. It's a visit. So you are writing a referral because you want to be confirmed. So you are writing a referral letter. On the same day you checked and then you are writing a referral letter on the same date. So date, you'll use the same date, 6th October 2018. So you are going to use this date right here. So this is the date. So 6th, so you have to write in full October, 6th October 2018. 6th October 2018. So this is component number 2. This is component number 2, that is the date. That is the date. So you will take the date from here, only one single visit, and the same day you are referring a letter. He will not refer next day because it's a visit and she will be leaving there. She will be leaving from there. Okay. So, right. So this will go into the letter. So when you are writing, you have to write it very carefully. How you will write? Let me give you, yeah. So single page. So we'll write the letter. How we are going to write the letter? Yeah, this is our letter. We are going to write the letter. Organize pages. Yeah, that's enough. So we are going to write the letter now. Yeah. So here, the first one is here. Address here. This is the address. Okay. So you are going to write this address first. So when you are writing, leave the first line. Leave the first line and you can write from the second line from here, from the left dot, first dot. So yeah. Okay. So you can write like this. Okay. So Dr. Mary Brown, Nixville Medical Center. Okay. So right. So you have to write very clearly. Dr. Mary. When you are writing, because it's copy paste, it's very clear, no problem. But you have to write letter by letter very carefully. So Dr. Mary Brown, start from the first dot. Start from the first dot. Don't write as you want. Some people write hither and thither. Some people start from here. Some people start from here. Some people start from here. No, start from the first dot line, first dot of the line. This is called the beginning of the line, and this is the ending of the line. This is the left margin. This is the right margin. Don't write in the left margin. Don't write in the right margin because there is no line in both the left margin and the right margin. Don't write. Okay, don't write 99.9%. Don't write here in this place because there is no line. You can try to write in the next line. Next one, Dr. Mary Brown. Okay, every letter you have to see. Nixville, even I was typing wrong. Medical center. So check that you are writing the proper spelling. Spelling mistake will be penalty for you. So Nixville Medical Center. The next one, 15 Green, see, Green Street. Yeah, 15 Green Street. It should be in a straight line, top to bottom. It should be in a straight line. Presentation is very, very important. The next one is Nixville. Sorry. Anything may happen. So don't think that you will be perfect. Yeah. So Nixville. So that is how you're writing this a letter. So Dr. Mary Brown, Nixville Medical Center, 15 Green Street, Nixville. Sometimes if it is a physiotherapist, so you'll write the name and physiotherapist. If it's supervisor, so you'll write supervisor in between these two things. So whatever is given based on that one, you can write. There may be many different things like state, city, country, anything may be there with post box number. So 5 lines. Okay. So anything may be there, which is there, you write, which is not there, leave it. So this is how you write. Then you will leave one line. You will leave one line here. This is a danger zone. Don't write anything here. Okay. Don't write anything here. This is a danger zone, right? So leave one line. Leave one line here. So after every component, leave one line. That's what I tell you. Okay. The next one, you're going to write the date. Now, what is the date? So date is here, 6th October 2018. So 06 October 2018. So 6th October 2018. So write like that. Okay. Left margin, maintain the left margin. So the beauty should be always maintained, even absent-mindedly. You are not supposed to do any mistake. Okay. Be very careful. Now what you are supposed to do? Next one, leave another line here. Leave another line here. Okay. Leave another line here. Right. So right, I wanted to give you red color there. Okay, fine. So again, leave one line here. So that means after every component, you're going to leave one line. There is no mercy for that one. It's not optional, it's a must. It shows that, so for example, when you remove these things, it is very clear for you. Okay. So you can identify very easily that this is address, this is date, this is something else like that. Leave one line here. Then next, yeah. Next what? Next you will write the salutation. So date is over. Date is over. Right? Date is done. Next one, we are going for salutation. We are going for salutation. Now, what is a salutation? What is salutation? So, are you all with me? Are you able to follow? Just a type yes. If you are clear, we have gone 2 steps ahead. So, you can just mention there. If it is clear, just type yes. Okay. If it is very clear, say yes. So, Smita, there are two Smitas. So, can you type your names? Smita Kant. so that I can identify that it is you and the other one is a guest. Yeah, thank you for the message. So now we are going for the salutation. Salutation means how you address him, how you call him. Address is different, and how you address means how you call him, how you refer him. That's the point. So salutation. So Dr. Mary Brown. Okay. So you will say, dear Dr. Brown. Dear Dr. Brown, or you can just say, dear doctor. But dear Dr. Brown is very important here. So you can say, dear Dr. Brown, because you know the name, right? So you can write, dear Dr. Brown. That's it. So dear Dr. Brown. Doctor in short form and Brown, second name. Don't write Mary again. Dear Dr. Brown. Dear Dr. Brown. So this is how you learn. This is called the salutation. Number 3. Number 3, the salutation. So the salutation means how you are addressing, how you are calling her. So, dear Dr. Brown, and put a comma, must put a comma here. Okay, it's better you put a comma here. Okay, so dear Dr. Brown, this is the salutation. This is the salutation. So once you write your salutation, okay, so dear Dr. Brown. So here you will go and you will write, dear Dr. Brown, comma, dear Dr. Brown. See that you will start from the left margin. Okay, that must be maintained top to bottom. Remember that. Dear Dr. Brown. The next, okay, next you have again, leave one more line. So you see every component, you are leaving one particular line. Okay. So here also leave one line. Leave one line here. Yeah. Leave one line here. 1 second, please. Class lo na ఒక్క నిమిషం. Five 5954. Yeah. So leave one line here. Leave one line here. Then after this, what next? The next one is the reference. The next one is the reference. Yeah. Reference. So what is the reference? Reference means who is that and about whom you are writing. So this is the reference. Think about this one now. Yeah. This is the reference. This is the reference. Fine. So now the reference, if you see the reference here, right. Now, Miss Betty Wood. So you're going to write this reference here. So that is regarding line. Regarding colon immediately. Regarding colon immediately. And then space. And then space. Then you write Miss Betty Wood, comma, aged 59. Simple. Learn one method only. No need to write, learn 10 methods and confuse yourself. No need to write. No need to learn. No need to learn 10 different things. Okay. No need to write. Learn 10 different things. Learn one thing, that is enough. Okay. This is one option. Then there is another option. This is age option. Regarding Miss Betty Wood. Date of birth, DOB colon 5 January 1959. So this is second option. So there are two options for you. So this is the reference or regarding line. So number 4, the subject. Okay, the subject. So this is the subject line or the regarding line or the reference line. Okay. So you are writing this one very clearly. So this you can write, or this you can write. The topmost priority is number 1. This is the most, okay. So this is the best option. This is the best option. So you'll give 3 points, 3 stars for this. And for this one, 1 star. Okay. This, if date of birth is given, write date of birth. If date of birth is not given, then write age. If both are given, then write date of birth. Because date of birth gives more value, more credibility. Date of birth gives more credibility. So this is 3 points and this is 1 point. So best. When both are given, you write a date of birth. When only age is given, then write age. Date of birth is not given and only age is given, then write age. But if both are given or only date of birth is given, better to write date of birth. Remember that. Now, so 4th point, that is, we are going to write the first point because, yeah, regarding Miss Betty Wood, date of birth 5 January 1959. So that we are going to write here. So regarding colon Miss Betty Wood, comma, DOB capital letters. So that is 5 January 1959. 5 January 1959. So 5 January 1959. Okay. So that's it. So you finish this one also. Now what you are going to do is you are going to leave another line here. So after every component, you are going to leave one line. Remember that. Mind you, it is very, very important. Sorry. So leave one line here. Leave one line here. Okay. Right. So now we are going to the body of the letter. The body of the letter. The body of the letter. Okay. Now the body of the letter. So we are going to write the body of the letter. So body of the letter we'll see later. But first we'll see these are the preliminaries. The you can say these are the starters, and this is the main course. And next the desserts. Desserts means the closing things. Okay. So again we'll leave after the body. We'll leave another line. So body will write in 5 paragraphs that we'll discuss afterwards. The other things, the less important things we'll see. Afterwards, we'll focus on the body. So now let me know. Yes. So all of you. So clear. So is it clear? Just a comment. Is it clear? Should age be in capital letter? Farid. So this is not Dr. Farid. This is somebody else, a newcomer then. Okay. So Farid, you are not supposed to put a capital letter for aged because it is after comma. Date of birth, abbreviation, DOB. So you will put capital letter. But age, you will not put a capital letter. Okay. I have already given you here. This is the model I have given you. That means it's clear. Okay. So if you are clear, then just type the letter, type the word yes, so that we can move to the next. I'm waiting for your responses, please. If it is clear for you, just type the word yes in the chat box. So Smita, thank you. Smita, it is clear. Any more doubts? If you have, you can say doubt. You can raise your doubt. So yes. Sheetal Singh. Yes, Sheetal Singh, make notes, huh? Make notes, okay? Then Jyoti, yes. Smita Kanta, very good, yes. So we have two Smitas. That's why I ask you to all of you to give first name and second name. Then Kavi Priya, yes. And Sheetal, yes. Okay, sir. Right. So we have got the four things. Now after that one, we'll write the body of the letter. Then after the body of the letter, then again we'll go, sorry. We'll go to the next one. Yeah. So these are the closing remarks. So what are we going to write here? What are we going to write here? Closing remarks. I told you already. If it is the name is given, dear Dr. Brown, then you will write yours sincerely. If the name is not given and just a doctor is given, write a letter to your to the doctor. Okay, without a name, without the Dr. Mary Brown, it's a doctor. Write the letter to the doctor. Okay. Right, doctor in charge or somebody, nurse in charge or physiotherapist, just without a name, then you will write yours faithfully. So you are supposed to write yours sincerely. Yes, name is there. Name of the doctor is there, Dr. Brown, Dr. Mary Brown. So you are supposed to write yours sincerely. So that's how you will identify things here. Yours sincerely, comma. So put a comma after yours sincerely. So yours sincerely. Maintain the left margin always, I'm telling you. Maintain the left margin always. So yours sincerely. Then after yours sincerely, then what you are supposed to do is, sorry. Yeah, you leave another line here. Okay, you leave another line here. So that's it. You leave another line here. So after every component, you have to leave one line without fail. So leave one line here. Yeah. And then leave. Actually, here you have to leave two lines here. One for signature and one for name. So leave two lines here. Leave two lines here. Yeah. Right. So you're leaving another line here. So Because I'll show you an official sample letter. Why I am telling many people don't bother this one. I'll give you the official sample. You can see here 2 lines. Leave 2 lines. Okay. It's always better to leave 2 lines here. Yeah. So you're sincerely and then leave 2 lines. Then after that, you will write about yourself. Who are you? Community nurse. You are a community nurse. That much is given. Your name is not given. So don't write a community nurse. So write there community nurse. You are a community nurse. Okay. Community nurse. That's it. Yeah. So community nurse. So this is the way how you will write all these important. First one is the address. Second one is the date. Third one is the, many people write date before address. But normally in all official letters, samples you can see the address first and then the date first next. So address first, date next. Remember that address first, date next. So follow the same pattern which official letters are showing you. Don't try to write whatever somebody is telling or even I am telling. Try what OET is telling you. Follow that one very clearly. So, community nurse. If anything else is given about you, check there. Name of the hospital or anything is there. Name of the ward, anything is there? No, it's just a community nurse. It's not a hospital. So, if you are a community nurse. You are working in the community and you are providing services there. So, you are a community nurse. If any other things are given, you can write. Okay. Otherwise, no need to write. So, Mayston Street, Nixville. So this is the patient's address. Okay. You are a nurse in that particular community. Okay. So right. So that's enough. Community nurse. If all the things are given, you write. Otherwise, no need. So I think we have completed. Yeah, no, we are sure. We have completed the beginnings, the starters, and we have completed the desserts. Desserts means last after eating after having our main course, we'll have some desserts like ice cream or salad, fruit salad or something like that. So that is it. So we have finished all the things. So 1, 2, 3, 4 in the beginning and 6 and 7 in the ending, and fifth one, the body of the letter. That's remaining for us now. So reference also finished. We finished with the reference. Then we also finished with the closing remarks, and we also finished with the sender's particulars. Now the only thing we are left with is here. What are we left with now is, yeah, the body. The only thing we are left with is the body. So are you ready for the body now? So the body of the letter. So is all these things clear for you? Yes. So I hope everything is clear for you. So I want you to just comment. Kavi Priya, send a message to everyone. Don't give direct message to me because I have to change always. So um, now we are going for the body. Body. Yes. Body of the letter. So now you can just write your own sentences. What did you learn before? Now the second part, the main course, actual letter. We are going into the actual letter. Other things are also important. Actual letter is 75% important, and the other things are 25% important. Yeah. So write down your feedback for this part. Okay. For the part explained. Give your feedback in 1 or 2 sentences. 1 or 2 sentences, and get ready with your notebook, pens, pencils, many things we are going to practice. Write in a sentence. Yeah. So what did you learn today? So write down, I'm giving you 1 minute minimum and maximum 2 minutes. And afterwards, we are going into the main course. The most important 75% of the letter. Write down your feedback so that I will understand how well you are able to gather information and enhance your knowledge that is required for me so that I may understand that I am going in the right direction and meeting your requirements. Be generous enough to write a word or a sentence or a paragraph. Whatever you want to write, you write. How well was the explanation beneficial? How much was the explanation beneficial for you in your own words? Yeah, we have got valuable feedback from Ashwita Parmesh. Was easily understandable and effective. Then Umara Usama, well explained, sir. Thank you, both of you. Smita Kant, explained really well. At least one sentence. They are generous enough to write at least one sentence. So for the others, I think they are not very clear. Then next one, Jyoti Kaushik, way of teaching method, very excellent and easy to understand. Thank you very much, Jyoti Kaushik, for taking a minute to give the feedback. Because this is what, if I feel that it is beneficial for you, I'll give you more such sessions, more and more. So you are, yeah, Shilpa. Okay, very good. The 7 points she has mentioned there, very good. So making notes properly, right? So all these things are very important. What about the others? You have still 30 seconds. Try to show that you are generous enough. Yeah. So, right. So you have explained very well my learning experience today. How to write a letter. The 7 components. Good. Thank you. Right. At least 4 or 5 students have messaged. Thanks very much for your involvement, participation. Maybe the others are busy doing duty or something else. So that's why they may not respond. That's okay. We can understand. Generosity is not an ordinary word. Generosity is not an ordinary word. Okay. We should be very special to be generous. So try to be generous. Krishna, thank you very much. Explained effectively and in an easy manner. This is what I learned about you, na? So I'm teaching for 1 hour or half an hour or 45 minutes or maybe 2 hours. And at the end of the session, I should know whether you have understood or not. So I'm not going to get any credit for that, but I feel very happy when you message me that you have understood. Yeah, it's my pleasure, Ashwita. Thank you. Right. So now, what are the difficult? Now we have finished part A, that is the starters, the beginning part. Okay, the preliminary. The next one, the endings, the beginnings and the endings. We have finished. Now we are going to the main course. The main course, that is B, the main course. So we have done with A, the starters. We are done with the starters and see the desserts. Double S. Okay. Not single S, it is double S. Desserts. Dessert is different and dessert is different. Okay. Right. So we are going into the main course. Now, main course, we are dividing it into 5 paragraphs. 5 paragraphs. And these 5 paragraphs can be separated into number 1. Sorry, we can say 1. The introduction. The introduction. And the last one, the conclusion. So the introduction and the conclusion. So you have an introduction for every letter and a conclusion for every letter. The conclusion for every letter. It's a must. It's a must. So the introduction and the conclusion. Next, we have 3 body parts. So body paragraph, main, MBP. So second one, MBP, main body paragraph 1. These are the main paragraphs. Essence. So head and tail in between the main body, we call it. The entire thing is body, okay? But this is the head and the tail and the body, main body. So number 3 is main body paragraph 2. Main body paragraph 2. And next, the fourth one is main body paragraph 3. So it depends. It depends. These paragraphs depend on the type of letter. If it is an emergency letter, for example, emergency letter. Now, what do you mean by emergency letter? You will know that it's an emergency letter when he says urgent assessment, emergency evaluation, brought in by ambulance, immediate examination, assessment, evaluation. So the words you have to notice for these words, it is urgent. The word will be there, urgent, or you will say emergency, or you will say accident and emergency, A&E department, A&E department. So these words will be there, or BIBA, brought in by ambulance, brought in by ambulance, or sent through ambulance. Okay, brought in by ambulance and afterwards discharged, that is different. Now, when you are sending, so you can say some transfer to your hospital through by ambulance, like that. Okay, he's brought into your facility by ambulance, brought in by ambulance. So then, so ambulance, the word, yeah. So right. So when you see these words, it is an emergency letter. So main body paragraph 1 will be today's visit. Today's visit, because today is emergency. You will not talk about yesterday, day before yesterday, 1 week back, 1 month back, 1 year back. You will not talk about this in. So emergency is the priority. So today is emergency. So today's emergency points only you have to write first. It's a top priority. Top priority. So today's visit is first. Okay, today's visit is first. And then main body paragraph 2 will be other visits, the other visits, or the previous visits, the earlier visits. Okay, the other or earlier. So you can say just the earlier visits. Only the important ones, not everything. 5, 6 visits or they don't write about everything. The earlier important, relevant information only, which is irrelevant, you need not write. Remember that. You need not write the irrelevant information. Irrelevant information, you need not. So, emergency letter, urgent letter, if you know that it's an urgent letter, okay, then you will write today's visit in the main body. Introduction will be common. That's normal for everything. Conclusion will be common for everything. I'm talking about the 3 middle paragraphs, main body paragraphs. That organization I'm telling you. Today's visit, emergency letter means today's visit is important. Then next paragraph, you write about the earlier visits. Okay, earlier visits, right? Then in the next paragraph, you will write about the other histories and other important things. Main body, paragraph 3, the histories. What are the other histories? So you can say the medical history, the family history, the social history, the personal habits, body mass index, weight, and other things. All the other things will go to the last paragraph. So this is about urgent letter. Okay. What's actually happening now is very important. So the doctor should rush based on the urgency. That's the point. Okay. So don't start from the previous paragraph because urgency is not pointed out. So they will think that it is a normal case, a normal letter. So urgency is important. Right. So this is about urgent letter. And ordinary letters. Ordinary letters. So ordinary urgent letters will almost always 99% will be referral letters. Urgent transfer, no. Okay. Urgent referral. Okay. Urgent referral letter. Right. So referral letter, it's going to higher authority mostly. More responsibility is there. For example, nurse is writing to a doctor is writing to a surgeon, a doctor is writing to a physiotherapist, another department, higher authority in other department. We don't know anything about physiotherapy. I'm a normal doctor, so I don't know. So I'm writing to a physiotherapist. He is the authority over the subject. So normal person, ordinary person writing to a specialist is a referral letter. What do you mean by referral letter actually? A referral letter means you're referring a person who you know to a person who the patient doesn't know. So here the patient is there in between you and the other person. Now you know this patient, but the other person to whom you are writing the letter doesn't know this patient. So you are introducing this patient for the first time to another person who does not know this particular patient. That is called a referral letter. Try to understand that one. There are many people who write letters. I am referring the patient back to your facility. This is nonsense. Back to your facility means what? Coming from there and going there. That means the other person already knows him. When somebody already knows him, how can you refer him to that person? It's absurd, meaningless. For example, I'll introduce, for example, I'm going to introduce Shah Rukh Khan to you. Shah Rukh Khan is, or Arnold Schwarzenegger to you. Arnold Schwarzenegger is a Hollywood actor and Shah Rukh Khan is a Bollywood actor. So you know these celebrities. So I am going to refer Shah Rukh Khan to you if you don't know Shah Rukh Khan. If you already know, then you will say, I already know him. So no need to tell about him. I already know him. So that means a person who is already known, there is no need for a referral because the other person already knows him. Remember that. You cannot introduce a person who is already known to the other person. That's it. So referral means you are introducing a totally new person to the other individual. You know this person. The patient knows you and you know the patient. But the patient doesn't know the other person, other doctor, and the doctor doesn't know this patient. So that relation is not there existing. This relation is already existing. I and the patient. I am a nurse and this is a patient. So this relationship is existing, persisting, prevailing. Okay. But this is a new relation that I'm going to create. Then that is a referral letter. Mind you, that is a referral letter. Refer back is wrong. Refer only to, not back. Coming from there, and again you are sending there. If you say, I am referring the patient back to you, is wrong. The sentence itself is wrong by default. So don't use this phrase referring back. Okay. So referring a person you know to the other person who doesn't know the patient. That is a referral letter. And you know already what is an urgent letter. Ordinary letter. Now, ordinary letter are three types. One is referral letter, one is transfer letter, and discharge letter. Discharge is not an urgent letter. Discharge is not an urgent letter. Remember that. Why? You're discharging. That means his condition is quite fine. So it will definitely be an ordinary letter. Transfer. Transfer. Transfer letter also, it will be ordinary. Okay. Ordinary. Or urgent. Okay. Urgent transfer may be there. For example, a normal hospital to a super specialty hospital. Urgent transfer for special care. It's not referral, it's a transfer. Here we are not able to do. You can do it there. Okay. It can be either referral or transfer. So now ordinary letters. How you are going to write these ordinary letters? So today's visit, okay, is there. So you will write all the visits in the first paragraph. Right. For example, transfer letter. Discharge letter. Let us take discharge letter. Discharge letter. In discharge letter, in the first paragraph, okay, let us talk about discharge letter. Now, the patient is with you. The patient is with you. So you're writing a discharge letter. There are two different modes of writing a discharge letter. One is upon admission. The paragraph, main body paragraph 1. Main body paragraph 1, you will write like this. Upon admission. So how his condition is. That means at the time of admission. That means before admission. So this is called before admission. What was his condition? Before admission, what was his condition? So you will explain all these things before admission, the status of the particular patient. So before admission, the condition, the earlier condition before hospitalization. Next one, main body paragraph 2. Main body paragraph 2. Here you will write during hospitalization. During hospitalization. During hospitalization. That means from admission to discharge. From admission to discharge is during hospitalization stage. What you did, what all the activities you have done during this period. This is present perfect progressive or present perfect tense. That means these are ongoing hospital. He is not discharged. It is going on still. Tomorrow he will be discharged or today he will be discharged. But still he is in the hospital. So it is an ongoing process. So ongoing is a present tense. Don't write past tense in this particular phase. In the first paragraph, upon admission, how his condition was. That means now he is in hospital. So now he is in hospital. Before joining in the hospital, it was past. So write past tense only in body paragraph. Yeah, I'll respond to your question, Umara. So let me go in the flow. So here in main body paragraph 1, in the discharge letter, you are writing the patient's condition prior to admission, before admission. So there are 3 stages: before, during, and after. So before hospitalization is upon admission, how his condition was, how the patient managed himself, how the previous doctors are prior to this, how it was managed, what everything before that you will write in the first paragraph. First paragraph. Then now during hospitalization, you will write in the present tense. Present tense or present continuous or present perfect or present perfect continuous tense. Only this paragraph tenses. The next to a paragraph, paragraph 3, main body paragraph 3. Main body paragraph 3. This is post discharge. Post discharge. Okay, or upon discharge. Following the discharge, write whatever you want. Okay, so upon discharge, what you should do, because this is future. This is future. So write only future tense there. So in the first paragraph, write only past tense. I'm not talking about the introduction here. I'm not talking about the conclusion. I'm writing first, second, third body paragraph, main body paragraphs. Main body paragraphs. So upon admission, that means how his condition was before admission. You have to write that one. Okay, how his condition was when at the time of admission, and what his condition was before, and his family history and his other things. Histories, all past tenses will go there. All the past tenses will go there, right? The next one, presently, how is the condition of the patient? How is it is progressing? How are his vitals? And then what treatment modalities we are following? What type of medications we are giving? Dressing provided or not? Heat packs are there or not? What injections we are giving? What medications we are giving? During this, you have to write. During this, all this during hospitalization, from admission till discharge, everything included in this. It will be only present tense. Upon discharge, what you should do before admission, what the patient did and what other doctors and other activities professionals did, that is before. Did, past tense. Now what I am doing, what the hospital is doing, what the doctor is doing, how the patient is recovering is continuous. Now what is happening during this period, in this ongoing period, what is happening? Then after the discharge, what you have to do, the receiver of the letter has to do. So first one is the responsibility of the patient and the other professionals earlier, before admission. And paragraph 2, responsibility of the nurse and the doctor and the professionals during hospital, in the hospital, and all the activities. And third paragraph, upon discharge. So discharge plan. Discharge plan. There you are going to write. There you are going to write future tense. Yeah, narrative, it's not tense. Narration is a type of delivery. Narrative tense. Narrative, you can write in past tense, you can write in present tense, you can write in future. Narration will be there. You should do this one, then you have to do this. That is also there. So he will do that one. That is narration. Narration means what you are telling about past, present, or future. That is narration in a process, step by step. That is narration. Narrative is not a tense here. So tense is present, past, and future. Right. So, so that you can make a correction, Dr. Farid. Sorry, Mr. Farid. Yeah. So past, present, future. So from past we are coming into present. From present we are going to future. This is the organization of the letter. I've talked to you about urgent letter, and I have talked to you about a discharge letter. Now these are enough for now. So we'll go into the letter. Okay. So is the information is the uh, explanation clear so far? Yeah. Request paragraph always difficult. No worry. Okay. Yeah. Yeah. All of you respond, please. If you really feel that the session was well, I forgot to have my tea also. Yeah. Yeah. I'll clarify your doubts. Yes. Just please comment one or two lines or sentences, or at least a word. Don't be stingy. Okay. Be generous. Be open. Somebody is struggling here. Okay. Sitting alone at this time of the day and trying to explain you. Okay. At least one word that I understood, sir. No need to appreciate my session. Let me know that you understood very well. Yeah. So here, Umara Usama. Sir, if we know the patient, sir, if we know the patient, that's okay. But whom we are sending, don't know the patient. Whom we are sending to. Whom we are sending means again patient. You are sending the patient. Whom we are sending to, that means the receiver don't know, doesn't know the patient. So it's a referring letter. It may be a referral letter. Okay, it may be a transfer letter. It may be a discharge letter. The other person may know the patient, may not know in all the three cases. Okay. It doesn't mean always it is a referral letter. No. How can we write this scenario? Yeah. So that's it. A referral letter, it will be given, write a letter of referral. Okay. The next one. Yes, planning. Yeah. Request paragraph always difficult. No, it's very easy. I'll train you. I'm there for you. I am there for you. Ashwita Paramesh, very regular. She's gives feedback on the spot. Very good. I like such people who give feedback. Yeah, it's very clear, sir, about what to write in which type of letter about the tenses. Very, very good. Very, very good. Next, Smita Kant. Very clear, sir. Ashwita Parmesh. I was very worried and confused about what has to be written first and at last for emergency and discharge. I'm very clear now. Very good. Thank you. What about the others? You did not understand anything? Huh? Or you feel it's a waste of time to write two or three words, spending two or three seconds to tell the teacher that you have understood? Umara Usama. Sir, thanks for correction. You are okay, fine. Yeah. So request paragraph. What types of sentences should be used? Imperative request sentence. I'll teach you. I'll teach you. Very good. I'll teach you all those things. Yeah, Lahari, clear. So yeah, what about the others? What about the others who are there? 12 students are there. Among that, 2 are mine. So 10 are there. Ashwita, Parmesh. Yeah. Rekha, Sandeep, Lahari, Krishna, Kavipriya, Farid, Umara, iPhone. Who is this iPhone? Can you write your first name and second name, please? Imperative request, a spelling mistake. IMPER. Request sentences. Please shed light on it, sir. Very good. You have a good style of writing. Shed light. Shed light, not shade light. Shade means shade. Tree, in the shade you will sit. That is a shade. Shed means throw. SHED. Shed light. Your sentence is good, but a word you have used the wrong one. Sir, I don't know previously how to write a letter. Now I understood a way of writing letter. Yeah. So that's very clear. Good. There are some comments. Fine. Now we can go to the letter. So we had these points now. Now we'll go to the introduction. Yeah. Now in the introduction, you are going to write some things there. Okay. What are those things that you are going to write? So in the introduction, you will write about, say, okay. So in the introduction, right. Yeah. So in the introduction, we are going to write 5 paragraphs now. It's not okay. The introduction. So these are the 5 paragraphs, body paragraphs. Just I'm roughly giving, it's not the same always. It depends on the type of letter also. It depends on the type of letter also. Okay, right. So these are the 5 different things you have to notice. So we are going through the body now, right? So the introduction. First, we are going to write the introduction, right? Yeah. So I'm taking you to the new page. So that's it. Yeah, let us take this as one style. The introduction, the main problems, the other important problems, the discharge plan and conclusion. Okay, very different styles we can see. Okay, now let us forget about this. This is the style we are going to follow. Right, that's clear. Okay, so now let us think about introduction. First, we'll think about introduction. I'll not teach 10 different examples, okay? The introduction. Yeah. It's not for all the paragraphs, all the letters. It's all for discharge letter. Okay, fine. Now, introduction. I'm taking you to the new paragraph, new page. So, introduction. What are required in the introduction? The introduction. Paragraph number 1. Paragraph number 1 is the introduction. Okay. So the introduction, right? Now, what are the components that you have to write in the introduction? Number one, okay, the name of the patient, name of the patient. Okay, that is number one. You should know the name of the patient. So you have to write the name of the patient. Number one. Number two. Number two. Number two. What is the condition of the patient? The condition of the patient. Okay. Or you can say the stage. What stage? Stage. Um, explained. Explain the stage. What stage it is? Is it a visit? Is it admission? Is it signs and symptoms stage? Is it diagnosis stage or preliminary diagnosis stage or you can say about surgery, post surgery, underwent surgery stage or progressing stage, developing stage? What type of stage is? Okay, who was admitted, who presented or who visited or who was brought in by ambulance? What stage it is? What type of stage? Admission or checkup or home visit? Okay. So what is the backdrop there? Or who underwent surgery, recovering from surgery? So what is the stage here? Okay. Right. So for example, you can say admission or you can say visit or you can say, yeah, recovering. Okay. Or is it a diagnosis or his preliminary diagnosis or you can say signs and symptoms? Suggest. Okay. What exactly is the stage that you have to think about? Right? Yeah. Next one. Number three. Number three. Yeah, you can have many different things. Number three. Okay. And what is his condition? Medical condition. Medical condition. Okay. So diagnosis of what? Diagnosis or signs and symptoms of asthma, maybe. Signs and symptoms of asthma. That is signs and symptoms stage, preliminary diagnosis stage. Or diagnosed with asthma, that is diagnosis stage. Or is it recovering from asthma, recovering stage? Or visiting hospital for a checkup, visiting stage. Admitting, okay, admitting into the hospital, that is admission stage. Maybe anything. So medical condition means what is the disease or sickness? Disease or sickness or ailment or illness. You can, I'm giving you a lot of words so that you can play with the illness. Okay. So, medical condition, what is the disease or what is the sickness or what is the ailment or what is the illness? What exactly is it? Cut his finger. Okay, bruises all over the body, rashes, itching, anything it may be there. Broken bone. Okay, anything. Surgery done for bone fracture. So, fracture. So, that is the condition you have to write. And next, number 4. What is the purpose here? What is the purpose here? And what is the modus operandi? The modus operandi. That means, so type of letter you can say. The type of letter. The type of letter. Here there are two modes. Is it a referral letter? Many people don't know the spelling of referral. They write single R and double F. Great. And discharge letter. And then transfer letter. Yeah. So you're updating the information. If the patient has already come from that place and you are sending him to the same place, then you are updating information. That means the known GP. If that GP sent you and you are updating the information, that means you are transferring him back to his facility. Transfer back is okay. Okay. Discharge back is okay, but refer back is not right. So if you are getting the patient from that doctor and you are sending to the same doctor, then it is discharge back or transfer back or updating the information about. Try to understand that one. You cannot write refer back. So next one. So what type of letter is this? A referral letter or a discharge letter or a transfer letter? So that you will know from here. Write a letter of referral. Okay. Here also referral. Okay. Yeah. Refer to daughter's GP. So here, try to understand this one here. Daughter's GP. Daughter knows that GP, but the mother doesn't know the GP. Try to understand that very clearly. Okay. Your plan, you're referring to the daughter's GP. So the doctor knows the daughter, but the doctor doesn't know the mother. Try to understand this. Daughter's a GP, and you are the daughter's community nurse. You know the daughter, and the doctor also knows the. But the doctor's mother, Betty Woods, the doctor does not know. Remember that. So the patient is unknown to the doctor. So you are writing to the doctor. Yes. Next. So next one. So the type of letter. Next one is the purpose. Number 5 is the purpose of the letter. The purpose of the letter. What is the purpose? The purpose. So what the receiving person, the letter, the receiver of the letter should do? What the recipient should do? Should he do the assessment, evaluation, or examination? Or should he or she manage the condition of the patient? Or that person, should he provide care or dressings or monitor the patient? Or should he keep under observation? What exactly he has to do? That is the purpose. So the purpose of sending this patient, for example, I am a general doctor, general physician, and I tested you, and when I touched here, you said like this. That means maybe nerve problem or bone problem. Then you checked very carefully. Then superficially, when you touched the bone, then the pressure is there. So now you will write a letter to the surgeon. You will write a letter to the surgeon. So this is a referral letter. He came with signs and symptoms suggestive of fracture in the forearm. The name of the patient is Mr. Abraham Lincoln. Mr. Abraham Lincoln, who visited the clinic today, who has visited the clinic today with the complaint of pain in the forearm, is being referred to you. He has been exhibiting symptoms suggestive of a fracture. Upon examination, he is preliminarily diagnosed with fracture in the forearm. Preliminary diagnosis. Signs and symptoms suggest. It's not diagnosis. It's not 100% confirmed. It's just my doubt. Okay. So, the medical condition. He is being referred to you for emergency assessment and appropriate management, and proceed with the surgery if required. So this is the purpose. What is the purpose? I am referring the patient to you. I am sending him to you. He has too much pain and I am helpless. I don't know what to do. So I am sending it to you, thinking that I trust that you can do this one because I feel you are the right person. You are the authority over this particular subject. I don't have that power. So I'm referring him to you. So a powerful person, a resource person. You refer to a person who is a resource person who can do that particular job because you cannot do it all by yourself. You are helpless. Other person is powerful. You are powerless. So from powerless to the powerful, you are referring the patient. He can do everything. So the purpose is emergency evaluation. And then manage the condition. If okay, or has to operate if necessary, or to suggest a sling, a plaster. Okay. So that is the purpose. Purpose is emergency evaluation. If normal, manage the condition. If serious, surgery. That's it. Hmm? That is the purpose. What is the purpose? Regular monitoring, assessment, provide a definitive diagnosis. I assume that it is this. You do whatever you want and give a definitive diagnosis, right? Because I cannot define what is happening.
What is the condition? I cannot. It's out of my power. Now it is in your hands. You are powerful. You can diagnose him. I can only tell what are the signs and symptoms and doubt that it may be a fracture. But you are the authority to test, evaluate, examine physically, or send for tests, or send for an X-ray and come out with a definitive diagnosis. Some doctors can send for X-ray, and based on that X-ray, they will refer. Okay, that's it. So it depends on doctor to doctor. So the purpose here is immediate evaluation, because fracture, and appropriate management. If required, surgery to be performed or send for a plaster, back slab. If required, this or that. Otherwise, no need, then you can manage. Then manage appropriately. Right. So that is the purpose. What you are expecting the other person to go to the market and buy some vegetables. Why am I sending you? What is the purpose? To buy some vegetables, not going to the market. To buy some vegetables is the purpose. Going to the market is the mode. Buy some vegetables is important here. Remember that. The purpose is go to the market and buy some vegetables. So going to the market is also important, not ordering online. So the purpose, what you want him to do. You want him to order online and buy some vegetables? Or you want him to go to the market and buy some vegetables? All these are 1, 2, and 3. 1, 2, and 3 options. Okay. So this is the purpose. What you want the other person, the receiver of the letter, to do is the purpose. Right? Important here. It may be evaluation, or it may be definitive diagnosis. Give a definitive, provide a definitive diagnosis. Okay. Or ongoing care, or appropriate management. Okay. So now I am writing in the white line. Why I should write in the white line? Okay. So I'll write in the next line. What is the problem if I leave here? No problem. If I leave here, no problem. I can write in the next line. Okay. Appropriate management. Okay. Perform an endoscopy or surgery or endoscopy if required, or whatever it is. So what you want him to do, is it an evaluation? You cannot evaluate, so you are asking him to evaluate. You cannot give a definitive diagnosis, so you are asking him to give a definitive. You cannot take care of him, so you are asking them to take care of him, manage the condition, provide a surgery, or do an endoscopy, or whatever it is. You cannot do, so you are asking them to do. You want them to do all these things and manage his condition. This is the purpose of the letter. Okay, this is the letter. The next one. So now next one. If it is a discharge letter, if it is a transfer letter, if it is a referral letter, where is he going? This is called the destination. The destination. The destination. Where is he going? Transferred back to your facility, or discharged back to your facility, or discharged back home, referred to your facility. Okay. So where is he going? So which place? The destination. Is he going to a super specialty hospital, or accident and emergency department, or care rehabilitation? Where is he going exactly? Is he going to the hospital, another hospital or a hospital, or is he going to another ward, from this ward to that ward, another ward, or is he going to home care, or is he going to rehabilitation center, or is he going back home? Try to understand this. This is the next one. The next one, number 7. So writing an introduction is not that easy. Okay. So follow all these points and try to give the best introduction. Is the seventh one is he going to the same place where he came from? Okay. Same or different destination? Then you have to say, so same or different. He came from one place and going to different place. Okay. If it is same place, you have to say back to your facility. Back to your facility. Or you can say back home. Okay, he's going back home, going back to your facility, going back to his apartment, something like that. So that is number 7. Number 8. Number 8. When is he going? When? When? This is called the timing. Timing. When is he going? Today? Discharge when? Today? Tomorrow? Or day after tomorrow? When exactly? Today or tomorrow or the day after? Yeah. So when is he going? Or tomorrow evening or today morning or whatever it is, you are going to write this one. So I hope you understood the introduction part. I hope you understood the introduction part. Yeah, Rekha Sandeep, very good. Farid, very good. Yeah. So yeah, that's it. So the introduction, we have learned the introduction today. Okay. We have learned the introduction now. The introduction. So what you can do is you can take different letters and try to write the introduction part. Learn the introduction because you have 3 marks for this introduction. Small paragraph, but you have 3 marks for the introduction. Remember that. There you will write the purpose of the letter. If you do not, many people don't write the purpose only in the introduction. So they lose the 3 marks there. So now, so how well did you understand? Can you please provide your feedback for this introduction part? Whether you understood clearly or you did not understand. So now if you understand this, you need not learn 10 different letters. One letter is enough. The same style you can apply in different formats. If you understood, just give a yes and give a feedback in a sentence or two. So Sheetal, I hope you have made the notes. I already made them some points, bullet points. I think you made the notes very clearly. So you can post it to me. Yeah, who is this iPhone? Can you give your first and second name, please? First and second names, please. Sharon. Sharon Samuel, right? Sharon Samuel, where you went? I missed you. I was trying to reach you, but afterwards, you know me, na? I don't call again and again. I was thinking, what happened to Sharon? Is this Sharon Rufus? Not Sharon Samuel, not from Punjab, right? Sharon Rufus. Okay. I have another Sharon, my student, so that's why I was asking you. Yeah. I'll give you my WhatsApp contact. So you can send a WhatsApp message to me. All the new students, new members. If anybody is interested in the regular sessions, so today is a demonstration session. So, and if anybody is interested in regular batch, Sharon Rufus from Telangana. Okay, you're Telugu. I'm from Hyderabad. You know that? Okay. So I'll give you my WhatsApp number. So Sharon Rufus, first time attending the session. Yeah. So this is my contact number. You can send a WhatsApp message to me so that you can discuss. Tomorrow is my birthday, and I am giving 50% scholarship for those students who are joining today and tomorrow. Yes, you can contact me personally on my WhatsApp. After that, it will be full fees. Only for a few students for today and tomorrow, you can avail this scholarship. Yeah, Sharon Rufus. Okay. Thank you, Sharon. Yeah. So give me your feedback, write in a sentence or two. Who is this hands? Okay. How can you people send this? I don't know. Ashwita. Thank you. So those who are interested can contact me personally. I'm giving special scholarship for today and tomorrow. So first, second, rename Sharon Rufus. Yeah. Yeah. So it's time for dinner. So tomorrow also is a demo session. You can attend. Today we have learned how to write the introduction. So see you all. I'm giving you 1 minute. What will be UK time? Rekha, Sandeep. Yeah, UK time it will be 9 o'clock. I'm starting. 10 o'clock, 9 o'clock. That means it will be UK time 9 o'clock means 2:30 to 1 o'clock. Yeah. Tomorrow evening will be reading. Tomorrow evening will be reading. Afternoon will be, sorry. Mm, tomorrow morning we'll be listening. Afternoon will be writing, continuation of this. And evening will be reading. So message to me on WhatsApp and I'll add you in the group and I'll send you the links. So give your feedback and we'll wind up. 120 seconds. 120 seconds. Sir, could you please share this letter in the group? Yeah, I will. So, so this letter, file, save as, writing formats. Um, this is what letter? Miss Betty would lecture basics plus introduction. Yeah, I'm sending in the Telegram channel. Yeah, so that is the copy post link. Yes, I have already posted it in the Telegram channel, and that is the link to the Telegram channel. Yeah, one sentence I will correct. Yeah, you can send it to me personally. I will correct and I'll give you, Mr. Farid, a little tired. Na? You send it to me on WhatsApp and I'll correct and I'll give you there. Yeah, yes. Lecture notes. So I'll send you the lecture notes also. Betty Woods. Yeah, that is the lecture notes. And check it out. So, see you all. Thank you very much. Have a nice day. Thank you, Farid, for your comment.